balancing the bioenergetic field is not an optional extra that we can just choose to do or not do. It truly is a foundational step in creating consistent, lasting clinical results. If we work to restore coherence, to reduce the stress load, to open channels of communication so the body is able to repair, we're giving it what it needs, right? We're giving the body the ability to use all of the power that it has to repair itself. Hello, everyone, and welcome. Thank you for joining me today. In this training, we're going to be talking about the role of bioenergetic field balancing in obtaining clinical results. Now, we know that healing is not only about tissues, organs, or even chemistry. It's about energy. The human body is an intricate bioenergetic system with fields that regulate communication, coherence, and overall function. When these fields are disrupted or they're imbalanced, then symptoms will emerge. And when they're harmonized, we often see profound improvements in clinical outcomes. So what we're going to do in this training is explore how bioenergetic field balancing works. We're going to talk about why it matters and how we can integrate it into your clinical practice to enhance results for patients struggling with things that we deal with all the time: chronic pain, inflammation, and of course, systemic imbalance. So what is the bioenergetic field? Well, we talk about this a lot. Every cell in the body is electric, and as an electric being, it generates a measurable electromagnetic field. Together, these form a larger field within our body that extends from within it, called the bioenergetic field. And this is a dynamic web of communication that extends beyond the physical body. This is all about things like cellular signaling, right? Because bioelectric potentials of the cells guide tissue repair, inflammation resolution, and even gene expression. And this will lead to system-wide coherence. The heart, the brain, the nervous system, these project strong fields that organize communication body-wide. We also know that disturbances can be an issue here as well. Stress, trauma, toxins, chronic illness, these fragment the bioenergetic field. This leads to disorganized healing responses. In clinical settings, we focus only on biochemical interventions. But when we're looking to address the energetic framework, which is what we do in energy medicine, we're looking to look at the conditions that are required for the body to reorganize itself back towards a healthy state. So how does this impact clinical results? I suppose, why does it matter so much? It's something that we do naturally, by the way, with microcurrent, but it is important because it is the underlying communication system of the body. When we restore communication, we can improve that system. The body's healing depends entirely on clear communication between cells, right? We see this with scar tissue, for example. Microcurrent therapy, PEMF, Scalar, all these things help align that disrupted signaling, allowing tissues to hear the instructions required for repair again. And this will reduce the stress load on the body when we repair this field too, because an imbalanced bioenergetic field keeps the nervous system locked in sympathetic dominance. Balancing protocols calm the storm. They shift the patient towards that parasympathetic rest and repair state where true healing can take place. Patients often plateau because their systems cannot integrate treatment anymore. And when the field is balanced, they become more responsive, not only to energy medicine, but also to nutrition, exercise, and all of the lifestyle interventions that we try and teach our patients. And the biofield repair can also help to support emotional healing. Emotions, and many of us will have experienced this, whether with patients or with ourselves, they leave imprints in the biofield. And by restoring balance, we can release the energetic kind of stuckness, I guess, that holds patients in cycles of pain, in places of anxiety, or in chronic fatigue. And this contributes directly to better outcomes. Now, practical approaches that we can put into play are things that we already are doing. Systemic protocols like vagus nerve stimulation, grounding, these help to restore overall balance. Also, applying the targeted frequency programs to disrupted areas to repair scar tissue, to remove inflammation. These things are all helping to correct that biofield. Scalar is an interesting one here because scalar energy devices, they help entrain the chaotic fields back into coherence by reducing that chaos, right? And improving things like heart rate variability and nervous system balance. The great thing about this is that you really only need to turn it on and point it at the area. Now, these protocols are especially useful for patients with stress-induced flares or chronic fatigue. Now, grounding techniques, I mentioned this already, but you can do this without microcurrent too. So patients can do this at home, getting some connection to the earth, whether it's through grounding mats or it's through gentle walking on the dirt practices, right? Get on that bare feet to the ground. These things are so easy to do for so many people, but it's something that they don't do. And grounding helps discharge accumulated static, and it restores electrical balance too. I think it's important that we layer these things together, starting each treatment session with a balancing protocol before moving into more targeted therapy. So balance the body's bioenergetic field. Even things like vagus nerve stimulation, right? They bring the body into that parasympathetic state. This will ultimately prime the system for maximum benefit, and it reduces kind of detox reactions, the Herx reactions that people are often so afraid of when they've been in chronic pain and chronic disease states for so long. Now, I mean, in practice, I've seen patients with chronic migraines. I've seen people with fibromyalgia, with autoimmune conditions experience breakthroughs only after this bioenergetic field is restored, right? We see this all the time. This is why scar tissue treatments are so important. It's all about this disrupted bioenergetic field. And if we can repair that, if we can bring that back together, I say this all the time, it can make 60, 80% of the problem go away just to restore that field. So keep in mind to be aware of this concept, to understand what you're doing on a deeper level, but know that as a microcurrent practitioner, you're already in the throes, every time you treat a patient, of restoring that field for them. You know, even a child here with anxiety and recurrent infections, which is something we often get concerned about, how do we deal with an infection, responded dramatically once vagus nerve stimulation was paired with daily grounding and working on the coherence of the body. Suddenly, these things start to melt away because the biofield repairs itself. Now, in these cases, things like these results that we're looking for accelerate because we've not just treated the body, right? We've treated the field that organizes the body. And this can affect people of any age, right? It really can. I think the important thing to take away from this is to know that what you're doing already is working on this process if you are in the microcurrent space, but that balancing the bioenergetic field is not an optional extra that we can just choose to do or not do. It truly is a foundational step in creating consistent, lasting clinical results. If we work to restore coherence, to reduce the stress load, to open channels of communication so the body is able to repair, we're giving it what it needs, right? We're giving the body the ability to use all of the power that it has to repair itself. As practitioners, we're not simply treating symptoms. We're guiding patients back to balance, right? It's physical, it's energetic, it's both of these things. And when the field is in harmony, the body follows. So thank you for joining me today. I encourage you to start thinking about this biofield. Start looking at situations with your patients. What is it that might be keeping their field from repairing? And looking at that. Sometimes this is as simple as going back to basics. The results ultimately will speak for themselves. Thank you everyone for joining me, and I'll see you next week for another 10-minute training. Bye-bye.